Let's talk about a few commonly related disorders that can come under the same umbrella of the differential diagnosis of primary sclerosing cholangitis. Most of these disorders have a similar presentation with cholestatic pattern, that is obstruction to the bile flow. They will be jaundice on examination. The labs will be abnormal for the cholestatic bile flow. What are the commonly related disorders? We have to distinguish primary sclerosing cholangitis from secondary sclerosing cholangitis. The secondary disorder is in response to certain types, to any problem in the flow of the bile. There can be any obstruction. For example, there is a stone in the common bile duct. There is certain type of pancreatitis. It can be a pancreatic neoplasm of the head of the pancreas that is obstructing the flow of the bile. So the cholangitis that develops in response to that primary obstruction is termed as a secondary sclerosing cholangitis. It is not a primary disorder, and it does not have that regular beads on a string pattern as we see in patients with primary sclerosing cholangitis. Similarly, cholangiocarcinoma, on its own can lead to obstruction of the bile flow and can give a cholestatic picture. And on the other hand, cholangiocarcinoma can also develop after a patient has primary sclerosing cholangitis. It is one of the common complications of this disorder. So we have to differentiate whether the patient developed primary sclerosing cholangitis first, and then eventually that led to the development of this cholangiocarcinoma, or whether the cholangiocarcinoma presented on its own as a primary disorder. Similarly, one newer disease that has been described for the biliary system is an IgG4 associated cholangitis. What happens in this is there is certain immunological disorder, any trigger of the immune system that led to cholangitis or the inflammation of the biliary tract. And whenever the histopathological pathology is performed, these patients had an increased lymphocytic population into the bile duct, and along with that, the plasma cell population is also increased, which is the IgG4 type of the plasma cell they are producing. So the histopathology is used to differentiate IgG4 associated cholangitis from primary sclerosing cholangitis. It is one of the common disorders that come under the umbrella of primary sclerosing cholangitis differential diagnosis. Histiocytosis is a rare disorder in which also there is infiltration of the bile ducts, and this generally presents in a younger population, in a pediatric population. So it is a rare pathology that can be described under the differential diagnosis. Autoimmune hepatitis is when there is inflammation of the liver as a result of certain autoimmune disorders. The way to differentiate autoimmune hepatitis from the primary sclerosing cholangitis is that autoimmune hepatitis has very certain types of antibodies association, like they have an increased ANA, and they also have an increased anti-smooth muscle antibodies, anti-PKLI, anti-liver kidney antibody, LK, which is abbreviated as anti-LK antibody, or anti-LP, anti-liver cytosolic antibodies. These are very commonly associated with this autoimmune hepatitis, and it is an autoimmune disorder, so it is also associated with certain other types of autoimmune disorders like Hashimoto's thyroiditis, or Graves' disease, or various other forms of presentation. So this is one way of distinguishing this from the primary sclerosing cholangitis. And when we do a biopsy, a liver biopsy, it will show the lymphocytic infiltrate, which is not present in a patient with PSC. Similarly, moving forward, in a patient population with HIV on its own can cause problem with the bile duct pathology. So in someone who has been diagnosed with HIV, we have to distinguish that whether this bile duct pathology is related to the HIV or whether it is a primary disorder presenting as PSC. Similarly, various types of bile duct strictures like extrahepatic biliary atresia in the pediatric population, or various other types of strictures can be formed as a result of biliary surgery or response. For example, someone has been undergone open laparotomy for cholecystitis, then various types of strictures can form as a result of this surgical procedure. So we have to distinguish that whether the strictures are in response to those surgical procedures or whether it is a primary sclerosing cholangitis. Choledocholithiasis, which literally means the stone in the common bile duct. If there is a stone there, that will obstruct the bile flow, and it will also lead to dilatation of the bile duct above it. So this has to be distinguished. Generally, we can very easily distinguish it with the help of an ultrasound. And if the ultrasound is inconclusive, then we can move on towards ERCP or MRCP. We're going to talk about the various tests which we perform to diagnose primary sclerosing cholangitis in the coming slides, and how and if you have a picture of the differential diagnosis in your head, then when we are going to discuss the labs, we can help you identify that why are these labs performed to rule out various types of disorders. One important disorder that comes very close to the differential diagnosis of primary sclerosing cholangitis is primary biliary cirrhosis. It has also been termed as primary biliary cholangitis. Recently, the name has been changed. The change of the name was because cirrhosis developed in a very less percentage of the population which were affected with primary biliary cholangitis. In primary biliary cholangitis, there is an autoimmune association. A certain type of autoimmune problem leads to the destruction of the bile ducts, specifically the intrahepatic bile ducts, and that can lead to narrowing of those bile ducts. And since it is an autoimmune process, it has associations with certain types of autoantibodies like ANA. Along with that, anti-smooth muscle antibodies are present in patients with primary biliary cirrhosis. Along with that, we'll have certain type of lymphocytic infiltrate, which will not be found in patients with primary sclerosing cholangitis. If we do a histopathological exam, the patients with primary sclerosing cholangitis will have onion skin pattern or fibrosis surrounding a bile duct. So the histopathology is important to distinguish these two disorders. And this is why in inconclusive cases, we perform the histopathology to arrive at a distinctive diagnosis. So I want you to keep primary biliary cirrhosis very high up in the differential list of the patients with primary sclerosing cholangitis. Rarely, certain types of papillary tumors arriving in the bile duct can also present with the similar signs and symptoms, and then we have to perform imaging to rule them out. So this list was very conclusive, and this list basically covered all the major disorders that fell under the umbrella of the similar cholestatic picture that a patient with primary sclerosing cholangitis presents with.